Why are art expectations so hard to manage? Imagine planning a family and hoping for the best, but feeling unsure about what might happen. That's often how people feel when they think about assisted reproductive technologies. These treatments can be a real hope for many couples and individuals trying to have children. But understanding what to expect from these procedures can be tricky. First, assisted reproductive technologies include procedures like in vitro fertilization, where eggs are taken from the woman, fertilized with sperm in a lab, and then placed back into the uterus. Success rates for these treatments depend on many things like age, health, and fertility issues. For example, women under 35 might have a 30 to 40% chance of success per cycle, but that drops as age increases. These numbers are averages, so they don't guarantee results for any one person. Another challenge is that these procedures come with risks. There can be complications like ovarian hyperstimulation syndrome or multiple pregnancies if more than one embryo is transferred. Long-term health effects are still being studied, which makes counseling more complex. Patients need to understand that outcomes are not guaranteed, and sometimes multiple cycles are needed. The rules and regulations around art are different from place to place. In some countries or states, laws limit how many embryos can be created or transferred. In the United States, for example, there is no federal law, so clinics follow industry standards and self-regulation. This can cause confusion for patients about what is safe and ethical. Ethical questions also make managing expectations harder. Patients might wonder about using genetic testing to select embryos or donating eggs or sperm. These choices involve personal values and moral considerations, which can influence decisions and outcomes. Counseling must balance medical facts with individual beliefs, adding another layer of complexity. Financial factors are a big part of the puzzle. Art treatments can cost from $10,000 to $25,000 per cycle, and insurance coverage is limited. Patients often feel pressure to succeed quickly, sometimes opting for multiple embryo transfers, which increases the chances of a multiple pregnancy but also raises health risks. Emotional and social factors play a role too. Infertility can cause stress, anxiety, and feelings of failure. The hope for a child can be very strong, but setbacks can be heartbreaking. As technology evolves and societal attitudes change, hopes and fears may shift, making it harder to set realistic expectations. When it comes to family genetic planning and hereditary health, managing expectations involves clear communication about genetic testing options. Preimplantation genetic testing can help identify inherited diseases, but it does not guarantee a healthy baby. Counseling helps patients understand what genetic testing can and cannot do, and how it fits into their family health plans. In the end, managing art expectations means providing honest, up-to-date information about success rates, risks, costs, and ethical issues. It also involves offering emotional support and genetic counseling tailored to each person's situation. This way, patients can make informed choices that match their values and health goals, even with the uncertainties that come with assisted reproductive technologies.